Okay, we're going to begin. So I'm going to turn it over for a second to Nick Scalera.
Good afternoon, everyone. This is Nick Scalera. Thanks for joining us for this webinar. Today, we're going to be talking about HIPAA, HITECH, and meaningful use readiness. I am the principal of EHR Solutions Group. Talking a little more about myself in a while. Also be joined today by Jerry Blass as the presenter. He is the CEO for Compliance Systems. Okay, with respect to the webinar, we're going to be discussing some of the key topics for HIPAA, HITECH, Omnibus, and very importantly, meaningful use audit readiness and preparation. Our main focus is to provide practical examples of information security compliance activities which you should be undertaking to prepare your organization for the increased scrutiny that you'll be subject to regarding privacy and security protections. Okay, first a few words about housekeeping. We put everyone on mute for now, and we ask that you text your questions via the provided box. We'll try and answer as many as we can at the end of the presentation. We also will have gotten some questions through email prior to the session, and we'll be answering those as well. The webinar is scheduled to last about an hour, but we're going to stay online for longer for Q&A, and you're welcome to do the same. Okay, if you don't have an opportunity to hear your question answered, please feel free to email them to this. We've included our email addresses for your information. And these can be security-related email questions or anything having to do with meaningful use or anything having to do with HIT. Okay, as I've indicated in the emails that went out to announce this, we are recording the webinar as a presentation. We're going to archive it, and we'll be providing a link to that as well as the recorded webinar shortly after the event. So if you, as long as you've registered, and I'm assuming you have since you're on the webinar, you'll receive an email with the links. We have bios, as I mentioned, at the end with email addresses at the end of the presentation. Okay, as I mentioned, my name is Nick Scalera. You may know me most recently from NJPCA, where I worked for 3 years, and my primary responsibility there was helping the federally qualified health centers of New Jersey satisfy the requirements of the Medicaid, New Jersey Medicaid EHR incentive program, and that included not only security risk assessments, but meaningful use, gap analyses, and so forth. I also wrote extensively on topics such as health information exchanges and so forth. And my business now is essentially helping folks, FQHCs certainly, but others as well throughout New Jersey, attain the same kinds of objectives. And I provide a variety of products and services, both through myself and through affiliations that I've made with other folks in the industry. And one of those folks is Jerry Blass, who is the CEO and president of Compliance Systems. Jerry has more than 35 years of experience in healthcare IT and compliance. He provides healthcare IT and consulting services along with software. His product is called Compliance Systems that automates the management and documentation of healthcare compliance activities. He's a member of NJHFMA and HIMSS, and co-authors quarterly columns for JHIM, the National HIMSS magazine. He's a co-founder of HIPAA 411, a popular LinkedIn group. You can visit his site, www.compliancesystems.com, for more information. I should also add that recently Jerry was invited by NJPCA to present at their annual conference in October. In fact, he's going to be doing a half-day session prior to the normal, the regular part of the meeting that is on October 29th. And the title of that session is Fulfilling HIPAA Security and Emergency Preparedness Obligations. So without further ado, this is Jerry.
Okay, Nick, thank you very much. I'm going to keep you unmuted in case you want to make comments along the way. If I do mute you, that'd only be if there's some kind of background noise that, I want to eliminate. So anyway, first of all, I know that Nick knows everyone who's on this webinar today, and I certainly would hope to meet everyone at some point. And I did actually do work in an FQHC in Newark. It was the Department of Child and Family Well-being, and that was a couple years ago. So I have had some experience in doing work in an FQHC. And this is what's really nice about this webinar, is that it is totally devoted to your organizations. So the agenda for today, we're going to talk about some definitions, just to make sure that any acronyms don't go, so you don't question, what does that mean? What does that three-letter acronym mean? High-level discussion points. We're going to talk about the risk, challenges, and motivating factors today in regards to HIPAA and HITECH and Omnibus. Recent breaches, which keep on happening, as probably all of you know. Omnibus, which was effective September in 2013. What is the impact of that? HIPAA privacy and breach notification versus HIPAA security. So what's kind of the high-level differences between privacy and breach versus security? Important compliance activities to reduce risk, such as PHI vulnerability assessments, proactive audits, workforce training, business associate and other third-party monitoring, and preparing for OCR audit, and also CMS audit for meaningful use, for all the stages. We're going to talk about stage 2 versus stage 1 in regards to the information security assessment. And then we have the Q&A opening up, and like Nick said, our bios are at the end. So we're hoping to do the presentation, have it done by 12:45, leaving about 15 minutes for Q&A. So here are some of the definitions. Of course, MU is meaningful use. Then there's OCR, Office of Civil Rights, CMS for the Centers for Medicare and Medicaid. ONC is the Office of National Coordinator. HHS is Health and Human Services. NIST is the National Institute for Standards and Technology. That is certainly the standards that we base the HIPAA compliance on. There's other standards as well, but NIST is the most common. EMR is Electronic Medical Record System. C, covered entity, such as you. All you FQHCs are covered entities under the law. BA, business associates, such as an EMR vendor or billing vendor. And we know that with Omnibus, BAs are now just as liable and responsible to protect your health information. PHI is protected health information. EPHI is simply the electronic version of it. HIE is Health Information Exchange, and ACO is Accountable Care Organization. So the discussion points for today: why has the risk of unauthorized access to identifiable health information increased since the 70s, for those of us that go back that far? What are the current challenges and motivating factors to reducing risk of breach? Why is workforce training so important? Why is BA monitoring so important now? How can CEs and BAs reduce risk? What can you expect with MU Stage 2 audits? Why is having evidence of due diligence so important? So the risks and challenges, we go back to, let's say, the 70s and 80s. Basically, HIT or IT was really known as data processing back then, and there was a mainframe somewhere, usually in a very secure location. And there were dumb terminals out with the users, and the dumb terminals did not store information. You were able to simply view and update into information, possibly print locally, but obviously the location of PHI at that point was centralized, and there was obviously no internet and no outside world and no email. So the location of where PHI could exist was very limited, and therefore it was very secure, but it was not as accessible as it is today. So there's always that balance between accessibility and security. Then we saw the boom in the 1990s, where we had LANs and WANs and servers and distributed applications to departments, internet, email, smart terminals, smartphones, laptops, tablets, text messaging, Wi-Fi copiers, on and on. And all of that during the 90s was great because it increased accessibility. But at that time, no one was really considering security. Then in 1996, HIPAA came into law, but it wasn't until the 2000 where HIPAA privacy and security became effective. the HITECH Act in 2009, meaningful use along with that, and the audits. And so basically, the technology took over. A lot of vulnerabilities were created from technology, and then there was the need to start to protect that information, and that's where we still are today. But since 2009, how many breaches have been reported? And many have. And how many before 2009? We don't even know. But we can only imagine how many breaches could have occurred before the requirement to report them. Uh, so today, in addition to single organization concerns, we also have multi-organizational, such as HIEs, ACOs, business associates, governance, and information privacy and security implementation concerns. There's always been a constant, and I'm sure that all of you have the same situation, in that it's in general difficult to fund resources that are both human and dollar for protecting health information and to address the risk. So, as far as we're concerned, we believe that the highest risk, if you look at risk assessment, is the lack of resources, and that's what it has been up to now. Hopefully, that will be changing. That remains to be seen. But going forward, new risks and vulnerabilities will always appear due to change, whether it's organizational, whether it's technology, etc. And there are also motivating factors that will continue. So the motivating factors are the HITECH Act, where there's increased enforcement and lawsuits. We all know that if we're driving down a highway and let me just take care of that noise. So we're driving down a highway and we're breaking the speed limit. We continue to do so until we see the policeman on the side of the road. And so the increased lawsuits and enforcement penalties will tend to make us comply. OCR audits, the need for documented evidence of due diligence. Basically, when you have an audit, if you say you did something, that's great, but if you can't prove it with documentation, you really didn't do it as far as the auditor goes. Meaningful use attestation requires compliance with information security risk assessment and management measures. We believe meaningful use money has been probably the biggest motivating factor in organizations conducting information security risk assessments because of attestation requirements. So then there's business associates, and now with Omnibus, there's a bigger need to monitor them because they are to be held responsible, and covenant entities do need to know how they are protecting their information. You can't just assume that they're protecting it, because there's been many breaches due to business associates, and so they do need to come into your risk assessment program, the security management program. Business strategy is a motivating factor. HIEs, ACOs, and the need for governance and standards. Recent breaches, which could result in very bad PR, symptoms of obvious risk that require mitigation. You know, we're seeing news about breaches every week, if not almost every day. So they continue to happen. And the concept behind that is, in the previous slide when we talked about technology, well, all of the technology advancement of the 90s and into the 2000s until the rules went into effect is kind of like a hurricane, like Hurricane Sandy doing destruction on the Jersey Shore. It takes a long time to overcome that destruction. Well, it takes a long time to overcome PHI being put into multiple locations, basically all over the place. In other words, one organization could have PHI in every single workstation in their organization. When you have so many locations, it's difficult to get control over that. And, you know, that's why breaches have occurred. We all know that the most obvious reasons have been lost or stolen, vulnerable portable devices that were not encrypted. And so we're still recovering from this, and it's obvious that, you know, the breaches are still continuing. Each of the motivating factors have a dollar impact for both ROI and potential reduction in penalties and liabilities. Now, I'm sure you know, but did you know that HIPAA was actually signed into law approximately 18 years ago? It's been that long. HIPAA privacy and security went into effect over 10 years ago. HITECH was signed into law in 2009, Omnibus 2013, when it went effective for the final rule, effective. And there's more to come. It's kind of like the law that keeps on giving. They're not done yet. There will be more, like accounting of disclosure, the new update there. That will potentially come out this year. We're not sure. And of course, breaches are still happening. So even with 18 years behind us, when HIPAA was signed into law in the Clinton administration, and over 10 years of privacy and security in effect, the breaches are still happening. So here's the breach tally and the enforcement. The federal tally of major breaches continues to grow, but even relatively small breaches can result in tough federal sanctions. And there's a reference in here. And then the total is now 30 million victims. And this is only since being reported since 2009. Here's a recent breach. This is May 9th. I'm sure you are probably familiar with, you probably get the same news that we do. This is New York Presbyterian and Columbia University, 4.8 million to settle alleged HIPAA violations after the electronic protected health information of 6,800 patients wound up on Google. I mean, we're talking about 6,800, which is not a small number, but there have been some breaches in the millions. But even here, the fine is 4.8 million, very high. Now, here's an example where, sometimes organizations think they've never had a breach. It's kind of like Hogan's Heroes, Starlock 13 never had anyone escape. And meanwhile, they're going out under the tunnel just about every night. So what's happening is that many organizations may not even know that they had a breach. And here's an example of one that went undetected for 12 years. Breach that may affect 4 million patients. So this was August of 2013, Advocate. And I'm not sure if 4 million is the accurate number still, but originally reported that it could have affected 4 million. An inadvertent email attachment causes breach at the University of Mississippi Medical Center, 2,281 medical center students. Transcriptionist breach affects 15,000. And I'm not going to go into details. We have plenty of slides here, but I'm just, going to go through some of them. And the idea behind having many of them just shows the extent of how often they're happening. This one happens to be due to a stolen laptop and flash drive, but actually what they're indicating is that the laptop was encrypted, but the flash drive was not. There's a clinic data breach affecting 1,400 patients. It's Lubbock in Texas. Let's see, medical records were accessed by an unauthorized individual. So there is also the insider breaches and the need, obviously, for workforce training and to show examples of when an actual unauthorized access occurs, keep it in the training so that other workforce members learn about it and know that your organization is taking this stuff seriously. Subcontractors, we talked about BAs, and here's an example of a BA that caused a breach of 3,100 patients in Alabama. Here's La Palma Inter-Community Hospital. Let's see, here's another example of an employee causing a problem. So, we could go on and on, but then we'll run out of time before I get to anything else. So I'm just going to show you that these slides are in here, and you'll have access to them in the PDF format, and of course the recorded webinar. So we're just continuing to show you examples. There's a laptop that was stolen with 6,475 records. Another subcontractor problem, getting back to the BAs. Lost thumb drive. Probably one of the easiest ways to cause a breach because it's so small is to have an unencrypted thumb drive that has many electronic records on it that's easy to lose. This one affected 1.7 million individuals. And this is that famous wall of shame that you want to stay off. That's pretty obvious. It leads to many bad things when you get on that list. Okay, so that brings us out of the breach section and on to a discussion about Omnibus, which became effective in 2013. I mentioned that BAs and their subcontractors are just as responsible and liable for protecting PHI, that the breach notification rule now has a presumption of breach, and it's no longer based on risk of harm. Notifications to individuals is now based on 4 factors to determine probability of compromise. So it is still judgmental. They didn't get rid of total non-judgmental. It isn't black and white. You know, you have to consider the four factors and come to a conclusion and document it appropriately as to whether you need to notify the individuals. Penalties have skyrocketed, especially for willful neglect. An example would be an unencrypted, stolen, or lost laptop or other portable device containing PHI. At this point in time, there really is no excuse for having an unencrypted, vulnerable device lost or stolen, resulting in a breach. The penalties in the program fund the OCR audit program so that your organization can really expect to get audited because the program is in place. GINA, which is the Genetic Information Non-Discrimination Act, is now included in HIPAA due to Omnibus. Basically, that means that we cannot be discriminated against when it comes to insurance plans or employment if there is information that is accessed about us from a genetic standpoint. So the impact of Omnibus includes the need for policy updates, not all policies, but some, the BA agreement updates, the notice of privacy practice updates, and perhaps some breach liability insurance. There's also the breach notification rule policy update as well, and other privacy and security procedural changes. I can just mention a couple of them. So for example, since the Omnibus rule is related to the adoption of electronic medical record systems, when a patient asks for a copy of their chart, the rule says that if it's in electronic format, you have to provide an electronic copy. That's pretty obvious. The other thing is the accounting of disclosures, which has not gone final, but probably will this year or soon. So that's to be expected. Then there's other aspects as well, which we can go over either in October or if any of you have a reason to want to know more, you can contact us. So HIPAA privacy and breach notification. This is where we're going to talk about high-level differences between privacy and breach versus security. So privacy and breach, basically, both are procedural and apply to all CEs and BAs pretty much equally. Now, the exception is that privacy does apply partially to all BAs. Privacy in of itself applies to all PHI, hard copy and electronic. It's about use and disclosure, minimum necessary, NPPs. I mean, all of you, I'm sure, are experts on the privacy procedures, that they are black and white and they need to be followed pretty much like a cookbook. Same thing is true with breach notification now, even with the Omnibus update. There's the decision workflow applies across the board. So black and white, procedural, and cookbook. Now security is different. Security is focused on ePHI and risk management, and the requirements can vary for CEs and BAs based on current controls and gaps. So therefore, there is a need for periodic risk assessments, not only to do a baseline to know where you're at, but also for change management and reevaluations due to organizational changes or technical changes or changes in the regulations. Meaningful use also requires providers to conduct risk assessments in order to attest for the money. HIPAA security is meant to protect, that we call it CIA, the confidentiality, integrity, and availability of electronic PHI, to protect against unauthorized access to PHI. And you really, CEs and BAs should really include all PHI, even though security mainly focuses on electronic. But in doing an assessment, also consider hard copy and electronic, such as when it comes to disposal and things like that, and access to areas that have PHI. So that's when assessing risk. Need to assess administrative, physical, and technical safeguards and implement risk management governance. So in other words, have a plan in place to address the gaps and the risk and reduce it through mitigation. Assess organizational and documentation requirements and mitigate gaps. So we're talking there about policies and procedures and operational compliance that shows that you're really doing things. And then there's document document, and then when you're done, document for evidence of due diligence. Without that, you can't prove that anything was done. So reducing risk of breach. So we talk about rule assessments, and again, it's not a simple checklist. Risk assessments and mitigation. So there is, the risk is one part of the rule. And so risk assessment is part of your security management program, which is part of the rule. But you also have to assess the entire rule as to how, you are standing up to complying with each section. There are proactive audits that can be done to reduce risk. Workforce training is very important. BA monitoring. Do a mock OCR audit, maybe even do a mock CMS audit for meaningful use. Of course, your policies and procedures, that's a given because everything comes from there. So, security rule risk assessment. So there's administrative, physical, technical, and organizational. Administrative, assess threats and vulnerabilities to core systems, assess potential locations of EPHI in transit and at rest, such as portable devices, multi-user workstations, flash drives, etc. Document current controls, future plans, gaps, risk, and risk mitigation action items. Physical, you do walkthroughs and you have facility and device access controls that you look at, and device and media controls. There's also the need to have a physical facility security plan, maybe multiple for multiple facilities. Technical, intrusion penetration testing, intrusion vulnerability scanning, and other. Organizational, policies and procedures, BA contracts, and evidence of due diligence. So with proactive audits, the scope can be technical controls, IT security, applications, departmental workflow, business associates. Let's see, we get into more here. So high risk areas have to do with access management, encryption, data destruction, mobile devices. From a technology standpoint, DLP, data loss prevention, auditing and log management, vulnerability assessment and pen testing. And all of this can be using standards such as NIST and more. Now, just to give you a couple of examples of proactive audits. So, employee terminations. Now, depending on the size of an organization, the larger you get, the bigger there is a need to make sure that when an employee is terminated, they actually are inactivated in perhaps your Active Directory and your applications in a timely manner, especially if they have remote access as well. So if you have a process, you have policies, procedures, a process for notification, but you're not 100% sure if it's actually working, the way you know is to get a list from HR of terminations, do random audits quarterly or whatever time frame is appropriate for you, and determine if there are exceptions. And if there are, depending on the number, it could mean there's a breakdown in the process of notification. Same thing with BAs. If a BA has access remotely or on site to your systems, and if you have a number of employees from that BA, you want that BA to notify you in a timely manner when an employee is terminated because you don't want them to have access anymore. And if they do, they can become high risk. So those are just two types of proactive audits. There's another type, which would be certainly looking at when you have a VIP or an employee who becomes a patient. You want to certainly take a look at who is accessing their information, because there could be more motivation behind someone accessing it. There's also systems out there like IATRIC SAM, there's fair warning, and that software actually can look at audit logs for systems and have rules that can give alerts, such as someone looking at a patient who lives on the same street that they do, or someone who is looking at someone that has the same last name. Those are examples of rules that can be set up. So workforce training. One of the things we asked in the beginning on the high level was, why is it so important? Well, I think all of us know why it's important. Is number one, if an employee violates the law, you don't want them to say, well, no one ever told me I couldn't do that. It's, I was never trained. And if you have no proof of training, it puts your organization in a tough position. So you want to have a robust training program. You want to include HIPAA and HITECH in orientation. You want to have periodic reminders, annual competency testing, periodic live training, maybe for a major event like Omnibus, one-on-one counseling when there are incidents that occur, departmental meetings when necessary. And when you do physical security walkthroughs, if you see a problem, give some immediate feedback and include it in training. And very important is to make sure that sanctions are equally applied for violations and let the workforce know when there has been a sanction. You don't have to mention who, you can just mention generically that someone violated and was terminated or whatever the sanction was. We all know that the biggest risk for internal problems comes from the workforce because workforce members are authorized to access health information to do their jobs. So since they're authorized, they have the access, they could choose to violate the rule and your policies. And they are the biggest risk. So workforce training hopefully reduces that risk. There is obviously also the big risk of electronic breach due to lack of encryption and things like that. And that's where you get into the higher numbers. But both of them are to be treated equally important. So business associate monitoring. HITECH puts BAs front and center, as we mentioned. We do need to update the BA agreements and BA compliance requirements into contracts, implement due diligence compliance reviews, and automate where possible. For example, before a BA becomes a BA, if they're going to be accessing health information from your organization, you want to send them a pre-contract assessment. That's when they are most likely to respond because they want that contract. So do it in a pre-contract way, and then periodically go by risk with your highest risk BAs coming first, and then medium, and then low. Perform a risk assessment. Send them an assessment. You can either do it hard copy or through Excel or through an electronic mechanism, but it needs to be done. Need to survey vendors for compliance on a routine basis, not just at the time of purchase, as I mentioned. You can consider outsourcing to a third-party vendor such as Synergistic. If you're not familiar with them, they're out of Texas. They have a big presence in New Jersey. Full disclosure is that we are a partner with them, and they use our software to do the monitoring of what they call their vendor management program. But that's just one example. There's other companies that do it, and it is a daunting process depending on the number of BAs you have. It is kind of like the straw that breaks the camel's back when it comes to a lack of resources to do all this stuff. So that's why it may be a good option to consider outsourcing. And then also consider cyber insurance if you haven't done so already for breach response and coverage. Prepare for an OCR audit. This is not a meaningful use audit. This is a CMS audit. And you really should do a mock audit to prepare and have a third party come in and do it for you, just like you would do for organizations do for the Joint Commission accreditation type audits. You need to be able to show documented operational compliance. So here are some examples. Policies and procedures and operational audits, workforce training like attendance sheets, e-learning database, risk assessments and mitigation, disaster recovery and business continuity, plans and also tests, not just plans. Audits, incidents and their mitigation, facility audits and mitigation, PHI vulnerability assessments and mitigation. And PHI vulnerability assessment really means categorizing where all of your PHI may exist, either in transit or at rest. Have those categories like portable devices, flash drives, single user workstations, multi-user servers, Wi-Fi, etc. Where it can exist. Email, of course, and then determine what controls you have in place to protect the information and what gaps you have, what future plans you have to mitigate the gaps. Make sure you know your risk, what you need to do to reduce the risk, and those are your action items. That's a PHI vulnerability assessment. And these days, because of all the breaches, that's one of the most important exercises you can do. Then there's information security activity reviews, workforce sanctions for violations. So those are some examples of what they'll look for. You need to really drill down on each standard and implementation spec and provide documented proof of operational compliance. MU stage 2 versus stage 1. So in stage 1, there was some leniency, as I perceive from what I've heard in audits. But certainly a simple yes/no checklist long term is not enough. You need to be prepared to provide evidence of due diligence for having a risk mitigation program and governance. So stage two increases the need to show your security management program, not just that you did an assessment, but since stage one, what have you actually fixed? What is your process for ongoing risk management? And the other part is a focus on PHI for end user devices, such as workstations and laptops and tablets, smartphones. You know, are they being protected with encryption because they are vulnerable? And we know, and we mentioned before that failure to do so can now result in evidence of willful neglect and potential penalties. So you need to make sure that you have a comprehensive assessment done by a subject matter expert, whether that's internal or external. It goes beyond a checklist. It goes more into all the areas that we've covered today, and it needs to be very comprehensive. And that is not only for meaningful use, but to be prepared for an OCR audit and overall to protect your organization against the potential for breach. And if you do have a breach, you can demonstrate that you have due diligence, and that should result in less penalties. But obviously, you'll still have potentially bad PR and things like that. But hopefully, reduces the penalty dollar amounts and potential for lawsuits. You don't want to have willful neglect. And the other thing is, when you do these assessments, if you don't have a good, strong security management program in place to mitigate, that's almost worse than never doing an assessment. I mean, never doing an assessment is very bad, but knowing your gaps and your risk and not doing anything about it may actually be worse because that gets you into the willful neglect. Document, and then document. So we mentioned that before. Okay, so we finished up with my part of the presentation approximately 8 minutes early, which is okay, because what we could do then is get into some of the Q&A. And so I have a question here. How often should you perform a risk assessment? And so the first thing is you got to do your baseline. And what I always say is based on the results of that baseline, including not only administrative rule and risk assessment, physical assessment, and then also technical, which is your vulnerability scanning and your penetration testing and more. The time frame for your next one should really be based on the results of your first one. If you've had a lot of issues with the first one, you probably want to do another one after 6 months or so. Give yourself about 6 months to fix some of the gaps and then assess it again. When you begin to get cleaner assessments over time, then you can probably back off to once a year. But I would say do them every year. So that's the question. Next question is, what are examples of compliance with vulnerabilities identified in a risk assessment? So the first thing here is that we all know that no organization is perfect and never will be, especially even due to change over time, change management. In other words, you'll always have gaps of some kind. You'll never reach 100% gap free. Some organizations, I think, have a perception that their compliance means that they have no gaps, and that's not really true because that will almost never be the case. What compliance really means is that you're able to show due diligence of compliance activities, and we've mentioned a lot of those activities today. And so due diligence is really the key, and due diligence means documented evidence. And so that's what it comes down to actually know what your vulnerabilities are and what your risk is, to have a program in place to address it in risk order. A lot of those decisions depend on the cost of mitigation and things like that. So you may not always be able to do best practice or what you think is the best way to solve a problem, but you're going to document your decision. You're going to maybe have for the addressable items, you'll have an alternate, perhaps, method, such as policy and workforce training, if you think it can be covered that way. But that's what compliance is all about, and it really never ends. It's not, doing compliance for really anything is not a one-time event. It is a program. That's why they call it security management program. It's ongoing, it's periodic, and it's almost day to day what it really comes down to. So what kind of training should be provided to those responsible for safeguarding EPHI? I would say, we went over the list of a comprehensive training program. Certainly for every employee, there should be high-level training for HIPAA and HITECH during orientation. You don't always have hours to go through all the details, so it's normally kept to be somewhat high level. What I have found is one of the most effective ways to keep security in the minds of everyone that works in your organization is to have screensavers that kick in with reminders that scroll. So if we have, for example, identified about 35 or 36 potential reminders that are pretty much generic across the board. And organizations don't have to have that many, but if you decide on having 10 reminders that you're going to periodically send out, or 20, you can set them up in a screensaver, and that scrolls. And one of the best things that you see if you do a physical security walkthrough is a workstation that's scrolling and reminders to the workforce continuously. And it may not just be for HIPAA, it could be for your entire compliance program, but it's a great thing to do. And if you have an audit from the OCR and they're doing a walkthrough and they see that, that's going to go a long way. Those reminders stick in the minds of the employees, and they're seeing them every day. So beyond that, if you're going to conduct training, it could be based on the audience. And for basically any audience, there's always those top 10 things, like always remembering to log off when you leave your workstation. Do not have monitors displayed in public view. Do not talk loudly on an elevator about a patient. Do not keep hard copy PHI in public areas. So, there's the obvious reminders that should be provided to every employee. When it comes to IT and the folks that are really involved in the program, the training obviously becomes more robust and covers all of the standards and implementation specifications, and who needs to do what, and with privacy as well for the privacy officer and everyone involved in the privacy effort, and then for breach. So hope that answers that question. Next question is, what role can automated tools play in security management compliance? So tools can vary, and we've seen tools that are checklists, and they do have content, and it is a good guidance, get you started, get you going in the right direction. Eventually, what you want to try to do is have a tool that can automate most, if not all, of the compliance activities that you need to do. So whether it's assessment, risk management, audits, let's say policy and procedure management, contract management, and incident management, those type of things, and having the ability to assign mitigation out to your organization and tracking it. And basically what happens is it becomes a project management day-to-day tool. It becomes an audit trail of evidence of due diligence. And it's very helpful in an audit when they come in and take a look at your organization. If they see that you're organized, they tend to make the audit less stringent because they can see it. So tools can be very important. Having a lack of resources, the tools can help there because it makes you more efficient. But the bottom line is, whether you have a compliance tool or not, all of the stuff we talked about can be done, and you can build evidence even without an automated tool. How does meaningful use stage 2? Well, we already answered that one, how it differs from stage 1. And that is, let's see, that's the last question that I have. If anybody else has a question, you can type it in right now, and we'll give it a second to show up. And if not, then we'll be done with the Q&A for today. So continuing on, we'll keep our eye open for any more questions. But continuing on, this is the bio for Nick and how you can get in touch with Nick, and you see everything that he has done and what he can do. Here's my bio. It is possible that you could have questions come up after this webinar. If you do, you can feel free to email Nick and myself, and we'll do our best to get the answer to you. So with that, maybe it's good news, but we finished up a little bit early. It's 12:45, and we want to thank you for attending. We look forward to having discussions with you if needed, if you have any questions. And this is being recorded. It is going to be placed on websites, and it will be available along with the PDF to everyone who attended today. And we'll also get it out to all the folks that Nick knows at the FQHCs. So let me just unmute Nick again. So Nick, did you want to also add any closing comments?
Just that if folks are interested in hearing more from Jerry, as we already mentioned, he's going to be at the NJPCA annual conference, giving a half-day session. I also did a pretty thorough interview with Jerry that was printed in my newsletter, also available on my website. If you didn't get that, you can contact me. I'd be glad to send it to you. And finally, if there's any feedback in terms of how you viewed this webinar, if you'd like to see more of the same, if you have any suggestions for future webinars, also if you could get back to me with that information, I'd appreciate it. And thank you for your attendance.
And that's a good comment, Nick, in that you know, today was really higher level and bullets, but we can drill down, and we can have separate webinars or even on-site meetings to go to a more granular level on any one of these items that we talked about today. All right, so that's it. Thank you, everyone. Have a great Memorial weekend. Hope we have great weather.